back here with us on Urban Debate on Mirror Now. In India, we saw a spike in the number of COVID cases with 2,380 fresh cases coming in last 24 hours. That's 15% higher than what was reported a day earlier. The number of total fatalities is also rising after 56 people succumbed to COVID in the last 24 hours. India's daily tally had fallen below 1,000 mark on 4th of April. However, over the last few weeks, it is seeing an uptick in cases as Delhi, along with some other major cities, are seeing a surge in COVID count. The national capital saw 60% jump as the daily number of infections breached 1,000 mark in the last 24 hours, with around 1,009 cases coming on 20th of April. Now, with the announcement of free booster shots in government hospitals for 18-plus population, the Aam Aadmi Party government has made a big decision in a bid to encourage more people to come forward and take this booster shot if they are eligible. That is the need of the hour, according to the experts. Now, Biological E Limited's Corbevax vaccine, India's first indigenously developed receptor-binding domain protein subunit vaccine against COVID, has received emergency use authorization from Drugs Controller General of India for the 5 to 11 years age group, acting as another booster to India's vaccination program. So let's straight away now go across to our guests who are joining us on the broadcast, who will help us decode what is happening in some parts of the country. Is this going to trigger the fourth wave of COVID in the country? The way cases are rising, and how concerned should we be about the rise in cases amongst school children specifically? Joining us on the broadcast this evening is Dr SK Sareen, Vice-Chancellor ILBS. We also have with us Dr Ashok, Seth, Padma Bhushan and Chairman of Fortis Escorts Heart Institute. Appreciate both of you gentlemen. Thank you very much for joining us here on Urban Debate on Mirror Now this evening. Dr SK Sareen, let's begin the discussion with you. The way cases have started rising in the country, in some cities, in some states only for now, is it like the beginning of the fourth wave, in your opinion?
It is difficult to say whether it is fourth wave or not, but the surge is there. The way the numbers were increasing in 1 week, starting from less than, let's say, 0.06% to 1, 4, even up to 7-8% or so. So I think there is a certain surge in the number of cases. No one can deny that. Also, like, the earlier last year or early this year, we used to have, every day 50, 60 messages, oh, our relatives are sick or we need help. Now also, I think the number of messages requiring help, they have increased. So I think there is an increase in number of cases. May not be severe, may not be fatal. And the proportion of patients who are getting infected probably include now a major proportion or a large proportion are children or young people. So there is a difference, but yes, the numbers are increasing in Delhi.
Okay. Dr. Ashok said, how concerned are you because the cases are now being reported among school children as schools have reopened finally after about 2 long years? And what kind of precautionary measures do you think need to be taken?
So Heena, first thing I would say is, yes, there is no panic, but some concern. And it's too early to say whether this is a fourth wave. Clearly, part of this was expected as the restrictions have gone, as complete opening has happened, as many masking restrictions went away, the fines went away. Two things happened. Public thought that actually, as the masking fines went away, that there was no need to mask. In fact, there was no need to have COVID restrictions as the restrictions went away. So in fact, the inappropriate behavior came in, and as people mix, we're going to see a small surge. Time will tell us whether it's a surge or not, and truly genomic scrutiny is extremely important this time to understand whether variants are taking over and is this going to be a surge. So I don't want to go backwards and say that, when Omicron started, we were still saying, will this go into a wave or won't it go into a wave? It did go into a wave. Thankfully, it wasn't a serious wave. So I think For me, there are certain groups which now need to be very careful. I've talked about the genomic sequencing. That's an important aspect of the government to keep a scrutiny and surveillance on what's happening. But on the other hand, yes, children, that's an important age group. Schools have opened up. I'm very clear, we can't go backwards in any of the openings that we've done. It's economical, it's important economically, it's important for livelihoods, but it's also important for education. We can't actually sacrifice education on the altar of COVID. So what becomes clear is that clear guidelines for school and school children need to come forth. What's the biggest problem at the moment? Even if 2 children in a school have COVID, which they can, and it's just going to be a mild COVID, there is a panic amongst both teachers and parents and school children. They don't know which way to move after that. They don't know whether they should send their children to school or not send their children to school. So clear guidelines are now needed, just like we did it for those who need to get admitted after COVID. We need guidelines for the schools and school children as to how they can actually create an atmosphere where education continues in person, and yet COVID precautions are paramount. So like really having open windows, good ventilation, good spacing, education around COVID appropriate behavior maintained by children as well as the teachers, and sanitation and hygiene on a regular basis, and then understanding who to isolate, who to move, and yet education needs to carry on. So we're very clear, vaccination of children and young adults needs to happen. At the same time, education in person needs to continue, because that's the holistic education which our children need. They haven't had it for 2 years.
Interesting. Clear guidelines for schools is what the government should also now look at. Important point you've made, Dr. Ashok said. Let me go back to Dr. SK Sareen now. Reports are suggesting that the Subject Expert Committee of India's Drug Controller has given its recommendation to Biological E's Corbevax to grant emergency use authorization in children in the age group of 5 to 11. Do you think if this recommendation has come and if it is right, then the vaccination drive for children in the age group of 5 to 11 should also now begin quickly?
There is no doubt this is a timely and very useful introduction of a new vaccine. 5 to 11 is a very vulnerable group. As Dr. Seth also said, the kids are going to the school, the parents are worried, the children, their teachers are worried. There was a very major epidemic in Geneva early January, and this epidemic started from school kids, and from one class to the other class, and the second class to the teachers, and then to the families. And the simple message which I would like to convey is there were, after this, and also in California, there was one such school epidemic, was to have a concept of a bubble. Bubble means 5th class students go to the 5th class, don't mix with 6th. Section A goes to Section A, does not mix with Section B, and they come back home. And they use the same bus, the same kids. If there is a new kid or there is someone else who is entering, there must be an extra caution. So it's like a bubble concept which the schools and maybe some of the guidelines can consider. And the second important part, if one kid is unwell, I think he must, before going to school, the parents must inform, and also complete screening should be done in that school. Going to the vaccination part, the kids and their parents are worried whether what is the long-term effect of these vaccines in the kids when they grow up, and maybe 5 years, 10 years down the line. I would like to assure all vaccines, once they are cleared, they generally are safe. The vaccine is simply a subunit of a protein of the virus is taken in. And sometimes if you have the complete inactivated vaccine, like you have Covaxin, they're not harmful. They're adjuvants in which the vaccine is used are safe. So the vaccine must be taken as recommended by all the kids, and even from 5 to 11 years. I think it is good. If you take now, You will still have to wait for a few weeks before the effect of the vaccine comes. So do it tomorrow, do it today. And the Delhi government has done well to make it happen for all young adults free 18 onwards. So all of them should take vaccine now.
Okay. Vaccine is our very important shield against COVID pandemic because it's still very much here. Dr. Ashok said, one last question before I let you go. Now, I was looking at reports from other parts of the world. Children are getting infected around this time. Children who had COVID last year too are getting reinfected by COVID. Now, this is to allay the concerns of many parents because this time, strangely, we are seeing more and more children getting infected by COVID. And we had heard before the third wave that in the third wave, children might get infected. That did not happen, but now it seems to be happening. Should we be a little concerned? What can you tell the parents who are worried today?
I think my message to parents is that the COVID appropriate behavior, even amongst children, and I say younger children and certainly above the age who can understand, becomes an important part of passing the message on about the fact that masking still continues in close circumstances. And unfortunately, children are quite often in close circumstances of schools, etc. That sanitation and distancing continues as much as possible, apart from when they're in the open. Importantly, the important thing also to understand is luckily, most children have mild infections and we now have vaccines available. And just like Dr. Sareen said, I urge the parents not to move away from vaccination, not to have vaccine hesitancy for children, but consider it a necessity. And finally, we must remember that despite vaccination, we would still have it, but it'll be mild infection. And we need to follow the isolation protocols as we have learned them from the past, and critically make sure that the isolation continues and that children don't mix with other children. I think the responsibility finally, while the guidelines are necessary for schools and children, the responsibility lies with the parents themselves, lies with us, and is an integral part of how we're going to live with this virus, not for today, not for tomorrow, but for many weeks, months, and years to come. And therefore, it becomes a part of a major responsibility that we have. So there's just one more point that I would like to make on this. While we worry about the children, we know in Delhi in the sero surveys, and Dr. Sareen would bear me out, that it was already seen that even amongst children, silent infection had been very common. And there's a level of immunity related to infection, the true form of immunity, rather than just vaccination alone. And that may probably be helping a lot of children in these circumstances. But let's not be callous, let's not be careless, let's continue to be cautious.
Let's not be callous, let's not be careless, let's continue to be cautious. I think that is the message that needs to be sent to everyone in the country because we are seeing a rise in COVID cases. Thank you very much, both of you gentlemen. Dr. Say, Dr. Sareen, appreciate you joining us here on Urban Debate on Mirror Now this evening and sending this important message to the people, parents specifically in this country amidst the rise in COVID cases. Let's now move on and talk about another important story that we are tracking for our